Okay. This is my gastro insertion. Some of the things that I have is my stethoscope and my pulse ox. Some of my items I have is gloves, the tubing, a flashlight, a nemesis basin, um, steri strip, steri strips, um, lubricant, to lubricant, um, pH strip, a syringe, a Toomey syringe. I have a drainage bag, and then I have my disposable bag as well. I have gel, and I also have water. I have linen, and I also have a towel, so I can place my items on top. So I'm going to do that first. This would be my towel, my flashlight, what's in there, my drainage bag. I also have Kleenex, water, my MSS, my sturdy strip, my linen. Here's my tubing that would be in a bag, and it would have to be a sterile insertion for the patient. So first thing I'm going to do is go to the computer. I am going to check the order from the doctor. I am going to make sure that everything is current, and this is a procedure the doctor wanted to do. I would look up the physician order. This patient is Morgan Brown, 255204 is the MR number. This patient has no known allergies. Date of birth is 8/4/1970. I see that the order has been NPO since last night, and it is to be, the orders for today, 4/7/21, to insert a nasal gastro tube and get ready for that. So then now I would be coming, after I verified the order, some of the patient's rooms already have a computer as well, so I'm now going to come into the room. Hello, Morgan. My name is Rose, and I'm a student nurse, and I'm here to insert nasal gastro tubing. Your doctor has ordered it, but before I do that, I need to check your order again. And since there's a computer in here, I'm going to go ahead and verify a second time. So now I'm going back into the computer. Morgan Brown, MR 255250, no known allergies. Date of birth is 8/4/1970. You've been NPO since last night, and you have an order for a nasal gastro tubing. Okay, so can I please? I'm going to go ahead and verify a third time that I have the correct patient. So I'm going to see. Okay, Morgan Brown, 8/4/1970. Good. So I've got my stuff set up already. So what I'm going to go ahead and do is put a linen over. I'm going to put water in here for the patient, and it would have a straw with that. I'm going to check pulse for her right now. Good, pulse is good. So now I'm going to, no. I'm going to put gloves on. And then I have my syringe. What I'm going to do is I'm going to measure Mrs. Brown here. I'm going to measure from her ear to her nose down to the symphoid process right down here. And I would take a piece of tape and wrap the tape, or if I had a marker, I would mark the marker as far as it would be able to go into the patient's nose. I have extra tubing, but I don't want to put all of the tubing in there because it's not necessary. So that's what I would do. I have an emesis in case the patient throws up, so I would put that there as well. So I would start by having the patient blow her nose have her blow her nose, make sure everything's okay. I would take my light and I would look in the nostrils to see if there's any cracks, if there's any redness in there, irritation, drainage or anything. If there was drainage on the left side, I would not use that side. I would do it from the right side. Everything panned out, everything looks good. So now what I would do is I would lubricate. I would lubricate this. I would lubricate my tubing, and I would have the patient tilt her head back so that I can be able to start inserting. When I knew that it was right here, I'm going to insert towards the ear. I would then have the patient put her head down, and then I would give her the water and have her take small sips with the straw. As the patient is doing that, I would slowly push it in there, push it in there, push it in there, push it in there. And so I've come to my place where I have marked for the patient. And so I would take the sturry tape, and I would tape the patient. Once it's there, I would tape the patient, tape it around the tubing. Tape it around the tubing. I would tape there, tape around, tape it onto the face, and tape it on here for the patient, because this would already be inserted. And then I would, after I insert it and everything, I would take my stethoscope, and I would listen for placement. I heard a whoosh. That would indicate that it was in place. In case it was not in place, I would have call back the doctor and ask the doctor if we can get an x-ray just to verify that it is in place. What I would do now is I would take my syringe and I would aspirate 30 mLs to see what it is. I'm going to get gastric fluid from the stomach, and I would put it on my pH strip. The rest I would insert right back. The pH strip would either be a 3 to a 4, or it would be red in color, which would mean that I am in place at this time. That is what I would do. Okay, so that's the video for going ahead and inserting. If I was removing the tube from the patient, I would not have any of this extra stuff. I would be just me and the patient, and I would explain the whole procedure to the patient, what the doctor wants and everything. The emplacement tubing is so that we could remove extra air that's in the stomach, or if the patient had a bowel obstruction, and so we need to go this route with the patient. Now that the patient has healed, we will go ahead and remove it from the patient. I would follow all the same procedures. I would verify 3 times the odor, twice on computer, and then I'd come and explain to the patient that I was taking out the gastrotubing. I would check for date of birth and name, and I would explain to them what I was doing. I would gel in for the patient. I would gel in, and then I would remove the gastro. I would hold it in place, and I would remove the tape from the patient, and then I would have the patient take deep breaths. And as the patient's taking deep breaths, I would be removing this until the patient was done. I would hand the patient a Kleenex, and then I would also look in the patient's nose again, just to verify if there was any irritation or anything that has happened with the patient. And that is what I would do. I would take off my gloves, throw them away. I would gel out, and I would give the call light to the patient and go from there. Thank you, and that's my video.